Hi everyone, this is Dr. Shabri Hussood, the GP with special interest in diabetes, working in the southwest of England. I'm also the medical director of Adisha Health. Today is the day 6 of Diabetes Week and we'll talk about diabetes complications. So as we know, in diabetes, there will be high blood sugar, and that's because the pancreas is either not producing enough insulin, or there is insulin resistance, or the body is not producing insulin at all. That results in high blood sugar, and for a prolonged period of time, the high blood sugar causes complications. So the diabetes complications can be classified into acute complications and chronic complications. Let's talk about chronic complications first. The chronic complications can be classified as macrovascular complications and microvascular complications. So what do you mean by all of this? The macrovascular complications means the high blood sugar causes blockage in the bigger arteries which supplies the major organs like the brain, the heart, the limbs. In microvascular complications, the high blood sugar causes blockage of the smaller arteries which supplies the organs, for example, eye, kidney. So let's talk about the macrovascular complications. Now, the diabetes is the major risk factor for stroke, heart attacks, and also amputation. Amputation means obviously losing a toe or a limb. In the UK, every week, diabetes is responsible for 590 heart attacks and 770 strokes. That's a significant number. Coming to the microvascular complications, because it is blocking the smaller arteries and also the arteries which supply the back of the eye called retina, people can get diabetic retinopathy in diabetes, which is again a major cause of preventable blindness. And it can cause diabetic nephropathy in kidney, ending in kidney failure sometimes. And some patients can have end stage renal failure or kidney failure needing dialysis or kidney transplant. And it sometimes can also affect the nerves which supplies the limb and cause diabetic neuropathy, and that causes sometimes very severe and difficult to treat pain. So what happens in stroke? Diabetes means you've got high blood sugar. The high blood sugar makes the artery stiff and it causes a buildup of fatty deposits called atherosclerosis. Now that leads to a blockage of the arteries, and that clot can fly off to the brain and cause stroke. The mechanism is same in heart attacks as well, whereas here the arteries which are supplying the heart muscle can have blockage, and that causes the scarring of the heart muscle. The patients with diabetes are 5 times at higher risk of having heart attacks and strokes. So let's talk about peripheral arterial disease. So what happens is, in peripheral arterial disease, or the other name is peripheral vascular disease, the arteries which supplies the leg are blocked due to high blood sugar and fatty deposits. And that can cause various problems. For example, when you walk a distance, you can have pain in your legs called claudication. It can cause diabetic foot ulcers, and the serious complication is amputation. Coming to the diabetic eye disease, some people can develop a diabetic retinopathy, which is the cause of preventable sight loss. However, during the annual diabetic retinal screening, if diabetic retinopathy is picked up, it can be treated and blindness can be prevented. Coming to the sexual problems due to diabetes in men, diabetes is the commonest cause of erectile dysfunction. Coming to the sexual problems in women, diabetes can cause recurrent urinary tract infections and recurrent thrush. So coming to the gum disease, now what happens is, if you have got high blood sugar, you can end up having high blood sugar in the saliva. Because of the high blood sugar in the saliva, you attract bacteria which produces acid, and that can destroy the enamel. And also, because of the high blood sugar, that you are at high risk of developing gum infections. Let's talk about diabetes and mental health. That's an important topic, and it wasn't very well sort of addressed or managed for many years, but in the last, say, decade or so, or slightly longer, we are giving more and more importance to this because you need to have a good mental health to manage your long-term health condition, which is diabetes. I have attached a link, which is a PDF, and it gives a lot of information and it covers the different aspects. For example, communication and engagement, facing life with diabetes, diabetes distress, depression, anxiety, eating disorders, which comes with diabetes, etc. So let's talk about the acute complications. The common acute complications are hypoglycemia, which means low blood sugar, and hyperglycemia, which means high blood sugar. Now, when does hypoglycemia happen? So generally, this is seen in type 1 diabetics who are treated with insulin, or insulin-treated type 2 diabetics. Very rarely it can happen in patients who take a type of oral diabetes medications called sulfonylureas, example gliclazide. Now, when this happens, either yourself or the family, friends, and the colleagues who are around you should be educated to know how to support you in that situation. Example, I have got a teenager who is recently diagnosed with type 1 diabetes. She's in sixth form. Her friends have, downloaded the app of continuous glucose monitoring so that if she goes low, then they know they can support her. Coming to hyperglycemia. So here you can have high blood sugars. When will this happen? Well, either the medications that you're taking is not working, or you're not taking the medications, or you're ill. For example, you've got a chest infection or a urine infection or gastroenteritis. So these are the situations where your blood sugar can be high. You need to do regular glucose monitoring so that you're aware of your levels and seek medical advice appropriately. Now, I want to just briefly mention about these two life-threatening complications. Again, don't be overwhelmed with it. You just need to be aware of this. The first one is hyperosmolar hyperglycemic state. This is normally seen in type 2 diabetics. It happens due to severe dehydration and high blood sugars. For example, if they are suffering with acute severe gastroenteritis. The second one, which can be life-threatening complication, is diabetic ketoacidosis. This is normally seen in patients with type 1 diabetes or insulin-treated type 2 diabetics. This again happens due to dehydration, high blood sugars, and lack of insulin, and in the body there is a development of ketones, which causes acidosis. You might be thinking, I'm really, ending this video on life-threatening complications, but I just want to reinforce again, though, if you manage diabetes well, year after year, you can prevent the development of complications. If you take control of diabetes, you manage it well, you can have a fulfilling personal and professional life. Now, this slide gives you the resource and take-home message, especially for diabetic complications, is that, again, I want to reinforce, if you look after it, manage a good blood sugar, then you can prevent developing complications. Please don't do it alone, and you seek help and do it together with your healthcare professionals, families, friends, and loved ones. Thank you for listening, and tomorrow be ready to know about the diabetes treatment.